A stroke is any interruption of blood supply to the brain where oxygen and blood are interrupted, and that could either be caused by a blood clot, either in the brain or traveling to the brain from, let's say, the carotid artery or from the heart. It could also be caused by a rupture in a blood vessel that occurs primarily in the brain. And the essential outcome is interruption of blood and oxygen flow to the brain and results in death of brain tissue. Stroke symptoms, any abrupt change in either the mentation of the patient, meaning their thought process, or their physical attributes in terms of weakness, slurred speech, any drifting of the arm or numbness on one side of the body, sudden loss of vision. These are signs and symptoms that patients should immediately call 911 and get, hopefully, if they're in our area, they'll come to our emergency department, but certainly to the closest emergency department capable of handling a stroke. Anytime a patient experiences a symptom such as chest pain, shortness of breath, very high fever, any kind of seizure or convulsion, any coughing that is out of the ordinary cough, persistent vomiting or diarrhea, severe pain in any area of the body, specifically in the abdomen or the head, patient should immediately seek emergency care. Keep the patient stable, in most instances, probably in a supine or laying down position rather than sitting up, maybe with the head a little bit elevated. Continue to talk to the patient. Obviously, if resuscitation is needed, probably everybody should at least be somewhat versed in CPR to provide immediate care to someone who's become unresponsive. The treatment varies on the type of stroke, whether it's a clot or whether it's a ruptured blood vessel. So if in terms of a blood clot to the brain, we try to dissolve the blood clot with medication, and that has to be done within the first 3 hours of symptoms. If it's a ruptured blood vessel and bleeding into the brain, then we try to control the blood pressure, which may be responsible for the bleeding. And if the bleeding is severe enough, it may require a surgical intervention to evacuate the area of bleeding from the brain. At University Hospital, we're very experienced in dealing with stroke. We were actually one of the first hospitals in the area to be certified as a stroke center. We have exceptionally talented emergency physicians as well as neurologists available 24 hours a day. We have a radiologist second to none, and the treatment of stroke is been ingrained in our personnel in the emergency department so that we're very adept at handling stroke.